Hello everyone, my name is Darren Maines, and this is my reflection on a career as a preventive medicine physician. So to begin, let's start with the basics. Um, it's preventive, not preventative. I started out calling it preventative, but wasn't really finding much just because I was saying the word wrong. Um, but the main basics of the career is it connects medicine and public health while aiming to reduce risk for disease, injury, death, and disability on a population level. So the basic duties and responsibilities of the job they do vary depending on what setting you're working in, but these kind of apply to mostly any position, and it kind of just follows the basic cycle of public health. You're going to assess for issues in the community, you're going to analyze the population and identify various health problems, and you're going to research and select and research a target issue, collecting data and how that affects the population, and identify potential causes and possible links to other health problems. Then you're going to use the information, develop programs and intervention, utilizing planning strategies and incorporating medical and public health knowledge. And then finally, you're going to implement those programs out in the community using funding from your employer, whether you're working with a government agency or applying for funding through a grant. And then you're going to evaluate effectiveness. You're going to collect data from the recipients in the program and determine the results to see how it worked and just make adjustments as needed to make the program as effective as possible. And as I mentioned, the duties change depending on what setting you're working in. So in any government position, you're going to assist with local health departments, if not work with one, whether that's during outbreaks or just promoting preventive strategies in the community. With outbreaks, you can create intervention programs that teach people healthy behaviors to prevent and reduce a specific outbreak, whether that's getting your vaccinations or washing your hands. You can do epidemiology to, again, assess various health issues, and then advocate for legislation that promotes accessibility for preventive strategies, whether that's um, medical treatment or family planning. And then in hospitals, so many preventive medicine physicians still choose to work in a clinical setting, but they utilize those utilize preventive-based care when working with patients. Um, and they're more likely to be placed in leadership positions just because they connect the fields of medicine and public health, and so they're likely to manage healthcare systems and personnel, um, and encourage them to apply those basic knowledges of public health and prevention when working with patients. And then within academia, they're likely to participate in research, um, creating programs and interventions to prevent health problems in a specific population. And then there can educate medical and public health students. So the main responsibility that's found within all kind of um, positions as preventive medicine physicians is communicating health, wellness, and preventive strategies to the community. So to the basic logistics of the job, it's about a $208,000 annual salary, but again, that depends on where you work, who you're working with, and the geographic location of the position itself. But all positions are likely to have an hourly wage of $100 or more. And then the job outlook is very positive for preventive medicine physicians currently, and again, that's mostly due to the COVID-19 pandemic putting public health at the forefront. So by 2030, there's going to be a 5% increase in positions, making it about 430,000 available kind of employment opportunities for preventive medicine physicians. This is also likely going to be due to the current physician shortage, which is going to continue to worsen and intensify due to the fact that about 50%, over 50% of current physicians are 50 years or older, so in the next 20 years, over half of the current physicians will no longer be working since they'll be retired. So there's a very positive job outlook for preventive medicine physicians and physicians in general. So what are some awards and challenges of the career? So kind of as you saw, there are immense financial benefits, but there's a lot more to that. There's emotional fulfillment working in public health and in medicine, so that only intensifies with this career. But you're serving the community, you're creating initiatives by working with people and giving them the skills they need to promote and protect their health. And again, as you're placed in leadership positions, you can lead public health initiatives and be in the forefront and really create change that we want to see in public health. In medicine, we follow the medical model in our healthcare system. And That just we focus on treatment and on prevention. In this career, you can really change that, flip the script, and focus on prevention in the healthcare system. But like any other public health career, it's going to come with challenges. So the results and impact are difficult to observe. What I mean by that, in with regular physicians, when they treat patients, that's the results. They see people get healthy again. And you don't really see that with preventive medicine physicians. You're giving people the skills they need to be healthy, and preventing any uh, disease, injury, disability, or even death. But you don't see that right away. You'll see that through the prevalence and how the data and how different health problems will worsen or um, their severity will decrease. But again, it's not as observable as regular physicians. And then there's intense and lengthy education, along with any other physician positions. But the education training is much more intense than other public health careers. So that's important to keep in mind. So the basic education and training of preventive medicine physicians starts with medical school, and then you will complete a residency and an MPH, and then a fellowship. So the basic pathway, you start with a bachelor's degree, and there's no concentration or major required. You just want to complete the science-based prerequisites for medical school, and any other kind of experiences need to become a competitive applicant to get in. And then once you're accepted in medical school, you'll earn a Doctor of Medicine degree or a Doctor of Osteopathy degree. It just depends on how you want to treat patients and how you want to kind of act as a doctor in the future. There's no one is better than the other. It truly depends on the person. Then you complete a required 3-year residency program, and then complete an optional 1 to 2 year fellowship to specialize. So a little more residencies and fellowships. There's about 71 accredited programs in the U.S. located in medical schools, schools of public health, and government agencies, and hospitals as well. And it's very common for those to earn their Masters of Public Health during this time. So most preventive medicine physicians at this stage don't have a background in public health. So that MPH is critical to really get that knowledge on how to kind of apply those skills of prevention to a career in medicine. It's also not required to earn an MPH while getting a residency. There are programs that allow you to earn it in conjunction with your medical degree at the same time. And again, fellowships are not required, but they allow you for different specializations, which include addiction medicine, clinical information, and medical toxicology. Some essential skills that are required for the job is communication. You are you want to be able to communicate ways to promote health and preventive strategies in the community, while also practicing active listening to what the population has to say on what problems are really afflicting them. And then you want to utilize critical thinking and problem-solving skills alongside knowledge in science, research, statistics, public health, and medicine. And this just allows you to create programs and design them that allow them to be effective at treating the programs that target health issues. And as I said, preventive medicine physicians are likely placed in leadership positions, and so you want to be able to lead to connect the two fields of medicine and public health. And then monitoring, with any kind of public health career, you want to be able to monitor a certain issue in the community that affects a specific population. And so would I pursue this career? Yes. So a little bit about myself. I've wanted to be a doctor since I was 8 years old, but that passion started to swerve a little bit when I enrolled in the public health program at UNLV. And then I found this career that combined both my passions of medicine and public health. Being able to be a doctor and treat patients while also focusing on the preventative side of medicine and kind of flipping the script of the medical model in the healthcare system is something that really kind of changed the game for me. But there's also a positive job outlook associated with this career, and it's flexible with your interest in public health and allow you allows you to let it be what you want it to be. So to finish, I'll leave you off with a quote from Thomas Edison. The doctor of the future will give no medication, but will interest their patients in the care of the human frame, diet, and in the cause and prevention of disease. Thank you. Please let me know if you have any questions, and here are my sources. Thank you again. Have a good day. Bye-bye.